You're listening to Health Professional Radio with Wayne Buckler, and today my guest is Dr. Paul Butterworth. Now, Paul is a specialist podiatrist. He's based on the Gold Coast in Queensland, and he's here to talk to us about his practice and what goes on. Welcome to Health Professional Radio, Paul.
Thanks, Wayne.
Now, Paul, tell us a bit about your practice.
Well, I graduated around 3.5 years ago with my surgical qualification. And I'm a registered foot and ankle specialist and surgeon with the Australian Health Practitioners Regulation Agency. So basically my scope of practice is anything to do with the foot and ankle. So I'm able to provide advice on conservative treatment options and perform surgical procedures where indicated.
Now, Paul, I notice you've got quite a website up. Is that kind of routine amongst surgeons, or is that unusual? I haven't noticed one before.
Yeah, look, I think with a lot of the orthopaedic surgeons, they're starting to look at developing websites, and there's certainly some out there. I think websites are a good way to provide information to patients. Patients are pretty tech savvy these days, and so being able to have a website that provides information on conditions, contact information for where they can seek your service and so on, is, relatively important in today's world, I think.
And that's footsurgery.com.au if you're interested in having a look. www.footsurgery.com.au is that website. And as you say, Paul, it provides information about conditions and processes I notice on there for other professionals looking to refer patients to you. Does it get a lot of traffic?
Yeah, it does. I'm actually updating the website currently, and it should be ready within the next sort of 5 or 6 weeks. But yeah, look, it certainly does get some traffic. I certainly get some inquiries through there, and it's certainly been a useful tool.
That's interesting because it's kind of a bit, for many industries, I guess it's routine these days, but in health, it's probably a bit at the leading edge of technology, so it's nice to see.
Yeah, I think it depends on the practitioner and where they're working and so on, but I think certainly in dentistry and podiatry, probably rather than medicine, I think it's probably websites are utilised more because our referral pathways are a little bit different. So I think someone like myself, I tend to get patients coming to me who either can't get in to see an orthopaedic surgeon because there's such long waiting lists, or perhaps they're looking for a second opinion. And so I think that's where having a good website enables for that referral pathway to occur.
And what is I guess from a patient's perspective more than from a clinician's perspective, what is the decision point between an orthopaedic surgeon and a specialist podiatrist surgeon like yourself?
Oh, look, I think there's a number of different factors. I think that at the end of the day, patients often will choose a specialist depending on how they get along with that person. You can't please everybody, so often I'll get patients that want a second opinion. Maybe, they've sought an opinion previously and perhaps didn't want to go down that path. And so typically it comes down to the patients, how they connect with the practitioner, I think, at the end of the day.
Yeah, I think that's still pretty much universally true across medicine, that it's the human connection that decides the difference, whether it's a good doctor or a good patient or not. It's that human connection that makes the difference. Paul, is there a categorisation of your patients? Do you see a lot of sports people? Do you see a lot of aged people? How does your work break down?
Well, it's a bit of everything, from young kids to the elderly. I would say the majority of my patients are females, somewhere between the age of sort of 35, 40 to sort of 70, typically with forefoot deformity. So bunions, hammertoes, Morton's neuroma, things of that nature. But I certainly see, a lot of surfers who have particular problems, and I see lots of kids who have got bony deformities as well. But typically, females tend to have more foot problems than men, and partly that can be explained by female footwear.
Mm-hmm.
And also, females tend to be more susceptible to getting certain problems, foot problems, more so than men. So one example is a condition called hallux valgus, which is a bunion. And it's certainly, men get it as well, but it's certainly more common in females. And they tend to be the patients that I consult with more often than not.
Feet are one of those things that I think most of us are happy to ignore until they go wrong.
Potentially. Look, foot pain and deformity, and look, most people, your feet are down the end there and you don't pay too much attention to them until there's a problem. But I think using a condition like a bunion as a prime example, that is a condition that is highly correlated with an increased risk of falls and balance problems once we get older. And often patients will ask me, should I get this fixed now or should I leave it and see how it goes? There's no right or wrong answer. But certainly, with an ageing population, and I think we spoke last time about the rise of overweight and obesity, that there are more foot problems out there.
Yeah. So, Paul, most of our audiences, are clinicians in an acute setting. What would you like them to know about your practice?
Oh, look, I think the main thing is that there's an alternative option for patients who perhaps are waiting long periods to get into an orthopaedic specialist. And so because I'm a podiatry specialist, I do tend to have the ability to look pretty closely at what conservative options patients can trial prior to considering surgical intervention. So I think that's one of the benefits of my service, and that I like what I do. I think I'm pretty good at it, but that the option is there for patients who need it.
Yes, that's interesting. And referrals to you can just follow a normal GP referral process, or is there something special about it?
GP referrals are most welcome. They're not essential because our service is covered under private health cover rather than Medicare. So It's a little bit like dentistry, that patients can refer themselves. They can come in without a GP referral. And if they've got private health cover, then they'll be covered. And uninsured patients are welcome, but obviously they're out of pocket without cover.
That's interesting, Paul. Now, every industry has its misconceptions. And I was going to make a joke about paediatric and children here, but I'm not even going to try and do that.
Right.
What's the greatest misconception about your practice that drives you nuts and keeps you awake at night?
Oh, I think there's a misconception out there that perhaps we're not as well trained as orthopaedic specialists, and that's really frustrating because I had over 2,800 procedures in my log books before I graduated, and close to 500 medical rotations, both here in this country and in the US and UK. So in the UK, podiatric surgeons are well established within the public health system, and in the US, podiatric surgeons are performing over 80% of all elective foot surgery. I think in Australia, we're a little behind our overseas colleagues, and I think that just takes time. So, that can be difficult, but because we're regulated by the same regulatory body that regulates medical practitioners, I think patients can be well assured that we have to jump through the same sort of hoops with maintaining our accreditation. So, that can be frustrating.
You're listening to Health Professional Radio. I've been talking this morning with Dr. Paul Butterworth about both his website at www.footsurgery.com.au and his practice as a specialist podiatrist. Paul, it's been a pleasure to have you once again on Health Professional Radio. If anyone's missed the interview this morning, we have a transcript on our website and an archive on SoundCloud and on YouTube, and that's at www.hpr.com.